Travel is more than just ticking off countries. It's about the people, the culture, the food, the moments. I'm Pippa Hudson, and on Wonder the World, I invite you to join me every week as we explore destinations both near and far, with the help of fellow adventurers who share their unique travel stories. Listen to my podcast wherever you get them.
702 Health and Wellness.
It's 25 minutes before 12 o'clock, time for our health and wellness feature. Today, we are talking about type 2 diabetes, which seems to be on the rise in South Africa. Experts say this is because more and more people are eating processed foods. We are eating sugary drinks, taking those and calorie-packed meals, and at the same time, we're not getting enough physical activity. So obesity is also playing a major role. So we've invited Dr. Patrick Ngassa Piotie, who's the chairperson of the South African Diabetes Alliance, to talk to us more about this, because we've got to be concerned. I mean, right now, nearly 1 in 9 adults in South Africa are living with diabetes. That's around 4.2 million people or so. So it's a growing health concern, and one that deserves our full attention. Dr. Piotie, thank you so much for making time for us. Good morning.
Good morning, Clement, and to your listeners. Thank you for having me.
Let's start maybe by explaining what diabetes is and how does it affect the body?
No, thank you very much, Clement. Indeed, diabetes is a complex condition. We can say that. There are different types. But in the main, it is characterized by a high level of sugar in the blood. So whether you have type 1 diabetes or type 2 diabetes or even gestational diabetes, the main biological signs is that the blood sugar is elevated and the body is not able to regulate that blood sugar as it will do in a normal person, if I can use that term.
Yeah. Well, why are we seeing such a sharp rise in type 2 diabetic cases in South Africa?
The reason why we are seeing, and you had to say it's now reaching crisis proportion, as you mentioned, 4.2 million people affected. Some statistics or some data are even putting that number higher than that. It's mostly because of the changes that we are observing in society. For example, the migration from rural areas to urban areas, overcrowded urban areas, the adoption, therefore, of sedentary lifestyle. As you might imagine, our environment in the cities are more geared towards mobile transportation, using a car, not walking around, and we work on desktop where we use computers. Most of the time, we don't move around enough. And it also comes, obviously, with a limited or poor access to healthy food. It's become difficult to grow your own garden when you live in a city. It's easier because of long working hours to stop at a fast food joint and get yourself a quick meal there. Those conditions, those circumstances lead to us living poor quality lives, and therefore we are not spending enough energy and we are eating a lot, and we take on weight. Diabetes is highly related to obesity and overweight, lack of physical activities, as you said, and unhealthy diet. But all that in the context of a society that is changing and that is adopting poor lifestyle habits.
Yeah. So what can we do then? What role do changing diets and lifestyle habits play in the increase of diabetic cases locally?
No, thank you for the question. To answer this question to what can we do, it will be good to approach it at different levels. What can we do as a society? What can we do as an individual? What can we do as institutions, for example, 702 or any other companies around? At all that level, we can define what can be done to prevent diabetes. For example, at the University of Pretoria on the 10th of May, we had what we call the Great Diabetes Debate, where we call on various players to come and discuss that very question of whether we are doing enough in terms of responding to diabetes in South Africa. To answer you more directly, therefore, I would say as a government, the government should lead in building a society that is diabetes-free. For example, making access to healthy food, making healthy food more accessible. For example, in promoting healthy lifestyle, walking around, exercising, as it is done in countries like Rwanda and others. As individuals, as it is always our choices and the choices that we make, we need to not only be informed and inform ourselves, but as much as we can, we need to walk around. We need to limit the quantity of food that we have. We need to try as best as we can to have a healthy, balanced diet. But mostly my focus should be in us as a society creating an environment that allow those choices and decisions to be easily made.
Mm-hmm. And when it comes to the potential implications, what are we looking at for individuals with poorly managed diabetes?
No, the potential implications are unfortunately dire, as we've demonstrated in various research that were led by the University of Pretoria Diabetes Research Center. There are unfortunately high rates of complications. The care that is delivered to people with diabetes in South Africa, for the most part, it's suboptimal. Many studies have demonstrated whether the care is accessed in the private sector or in the public sector, we are not really meeting the targets. Therefore, people, because of living with those high levels of sugar, it has an impact on on many organs of the body called target organs. It affects the kidneys, it affects your brain, it affects your nerves, it affects the blood vessels. You have issues like amputations, kidney failures, cardiovascular diseases, and so on. And eventually, obviously, it could lead to death. So that's for diabetes.
Yeah.
Otherwise, easily preventable with good care and good education of people living with diabetes.
All right. It's 18 minutes now before 12 o'clock. I'm going to take a break. When I come back, I've got some questions that some of our listeners are asking about diabetes, some particularly about type 2 diabetes. That's what we're talking about this morning on our health and wellness feature. Type 2 diabetes seems to be on the rise. Dr. Patrick Ngassa Piotie is the chairperson of the South African Diabetes Alliance, just guiding us through this chat and helping us, also equipping us with what we should do. How do you respond when you're diagnosed with diabetes? What can we do? How do we change our lifestyles so that we manage those risk factors? What questions do you have? Or maybe you want to share your experience, your journey with diabetes. 011-883-0702 or send your WhatsApps on 072-702-1702.
702 Health and Wellness.
It's going up to 15 minutes before 11 o'clock on our health and wellness feature this morning, discussing type 2 diabetes. But I also want to hear from your own experiences. Are you struggling with diabetes? Is it something that you're living with? What have been your experiences? But also, I would like to know if perhaps you've got some questions for my guest this morning. That's Dr. Patrick Ngassa Piotie, who is the chairperson of the South African Diabetes Alliance. I've got some of the messages coming through now on the WhatsApp line. Vitalia says, Clement, I went for results with my dietitian yesterday and I learned a lot. Unfortunately, education is lacking, and I urge people to share in their communities and families. Stick to the diet as recommended. I'm seeing some improvement since the 20th of February. That's a message there from Vitalius, all the way from False-Loras. Let's go back to our guests now and maybe bring in some of your questions. Dr. Piotie, I've got a question here from one of our listeners, just about when should they be concerned if they've got diabetes, they're living with it. When should they be concerned and really start perhaps approaching a doctor, seeing a specialist? At what point should it be concerning and maybe thinking that it's not manageable or being managed well?
No, thank you very much, Clement. And I like the point that, before I answer the question that you made from the other listeners about education. It's really critical, and it's a topic that we can probably spend the whole day talking. It's really important that people living with diabetes are empowered. And I guess it's also connected to the question of the listeners about when should they be concerned. I believe that, and we all believe that diabetes is a condition that shouldn't stop anyone for living a long and healthy life. But there are some conditions that should be met for that to be achieved. For your listeners, the most important thing is to empower himself or herself and to understand what is diabetes, how does it affect his or her body, and what can he do as an individual to obviously prevent the progression of the condition. Therefore, it's about taking your medication and following a healthy diet if possible, and obviously exercising. In terms of when to be concerned, I wouldn't approach it that way. The person living with diabetes should endeavor to always be on top and in control of their condition. If that is achieved, there is no need to be concerned at any stage, because with the annual monitoring that they need, with the HbA1c and other tests, they will always keep an eye and keep a control of their condition, whether they are using insulin or not. There is no need to reach a point where there is concern, because every day, every week, every month that you spend with high glucose level, it's affecting your body. And unfortunately, this is happening completely silently. When the signs and symptoms, for example, when the eyes are starting to not see well or the kidneys are starting to fail, it's already at advanced stage. Therefore, one cannot wait for those symptoms before acting. We need to be proactive, and we need to take power and take control of our diabetes from the first day.
I've got a question here from Lillian, who says, Clement, please can you ask the doctor there, is type 2 diabetes reversible, and how can that be achieved?
Oh, thank you. That is a very good question, and this has been the center of many debates. In short, yes, type 2 diabetes is reversible. It could be achieved, for example, with important weight loss. For those people who might be having overweight, or who might be overweight or obese, if the research have shown that when you lose a significant amount of weight, your diabetes might be reversed. But obviously, all that needs to be done under the supervision of healthcare providers, and this needs to be measured and assessed adequately. It shouldn't be guesswork. It should be all done safely and scientifically. But it's possible through mainly losing weight.
Okay. Another question says, Clement, I've been diagnosed as pre-diabetic. I don't do sugar or starch or carbs, but I'm feeling dizzy all the time. Should I be concerned?
Okay, if the listeners has been diagnosed to pre-diabetes, it's important to tell the listeners that diabetes is not a stationary, a static condition. It progresses, meaning that's why there's terms like pre-diabetes and complicated diabetes. If the listeners are then be diagnosed with pre-diabetes, that means the doctor or the nurses or whoever made the assessment realized that were some symptoms or signs through a blood test or otherwise that were indicative of a state of pre-diabetes in that individual. What they need to do, if possible, implement a plan to try and reverse or halt the progression to diabetes. For example, as we already said, exercising, losing weight, eating well, and so on and so forth. Therefore, they will be able to stop. The fact that the listener might feel dizzy, obviously we need more information. They should probably consult the doctor about it. Maybe they are not eating enough because they are scared of the diagnosis that they've been given, or there should be a problem. It could be that they're experiencing sometimes hypoglycemia or others, but obviously all that should be done with the assessment of the healthcare providers so that a correct diagnosis can be made.
Yeah. Shireen says, Clement and the doctor, I have type 2 diabetes for the last 12 years. The most important tip I would give anyone with diabetes is to visit a diabetes educator. That made a big difference in my management. My meds have been reduced and my diabetes is well managed. That's a message there from Shireen. Masabata says, Clement, foods at the supermarkets have too much sugar. When can the diabetes have options without sugars? Even the toothpaste is a concern. And another question Nadas is asking is any sweetener good to use if you have diabetes type 2? Yes, doctor? Okay, I think we lost the doctor there? I think we may have. Let's do this. Let's take a quick ad break in the meantime. We'll try to sort out that line. I just want to get him to answer at least a few more of your questions before we let him go. It's 8 minutes now before 12.
702 Health and Wellness.
All right, so we are wrapping up our conversation on our health and wellness feature with Dr. Patrick Ngassa Piotie, who's the chairperson of the South African Diabetes Alliance. Dr. Piotie, there was a question that came up earlier on about sweeteners. Are they good to use if you have diabetes type 2?
I believe sweeteners are safe. They shouldn't lead to an increase in blood sugar level. There was also a listeners that re-emphasized the importance of education and mentioned visiting a diabetes educator. Unfortunately, in South Africa, that service is not broadly accessible, especially in the public health sector. The role of diabetes nurse educator, which is a recognized role internationally, and obviously the importance of such a role has been seen or demonstrated in other places, hasn't been unfortunately adopted in South Africa. Therefore, our nurses are not able to specialize in diabetes education. And I think as the Diabetes Alliance and other players, we come from attending a conference in Durban by the Society of Endocrinology, Metabolism and Diabetes in South Africa. It is common understanding that we need diabetes nurse educator in the country. With the magnitude of diabetes in South Africa, with the needs that people living with diabetes have throughout their lives, it is important that they have people to support them and to take them through this journey of getting information and being empowered in managing their care. Therefore, I will take this opportunity really to call on authorities to consider diabetes nurse educator, and that will allow more people than the listeners that sent the message to benefit from this, because people with diabetes should be at the center of their condition and they need to be empowered. They need to receive education for that.
Yeah. And any advice for perhaps the role that communities and families can play in supporting someone living with diabetes?
The role of families, thank you for the question, Clement. The role of families and communities is very much critical. That's why at the Diabetes Alliance, we started an initiative to launch what we call Diabetes Alliance chapters, whereby in every province of South Africa, we are developing a grassroots movement around diabetes. We are calling upon people living with diabetes and their family members to join those. They can find information or they can reach out to us with our email that they can find on the Diabetes Alliance website. Yes, the communities, the families have a key role. You need to understand that diabetes is a condition that unfortunately affects the person also mentally and psychologically. They feel isolated, there is stigma and otherwise. If we don't have a societal, a community approach to address the stigma, to support them, really it leads also to poor outcome. So it's not only about the individual and us pointing fingers, it's about the family creating a supportive environment. It's about the community. We can have community gardens. We can have exercising as a community to ensure that not only we support those who have diabetes, but also we prevent diabetes in our community. And I believe that this is where we should go, grassroots movements where we empower our community and we empower our families to support people living with diabetes and to prevent further people from getting diabetes.
Yeah, there was someone else who was worried about how much medication sometimes, people who have diabetes have to take. Are there instances or opportunities where someone can reduce that medication so that it's not as much as, ordinarily they take?
No, it becomes a challenge because, yes, unfortunately, when somebody has diabetes, they might have hypertension, they might have cholesterol problems and mental health or whatever else. Therefore, the pill loads become heavy. There have been attempts to try to test polypills, meaning one pill that can cover a number of conditions. Unfortunately, they might be expensive or not widely accessible in the public sector. But there's been some work in terms of trying mainly through the polypills, but also if the person maybe can move to using insulin or other options, they might reduce their pill loads.
All right. Dr. Patrick Ngassa Piotie, thank you so much for guiding us through this chat. It's a minute before 12.